Hi, my name is Pamela Torres, and I'm going to talk about anticoagulation with or without clopidogrel after transcatheter aortic-valve implantation. Definition: Clopidogrel is an antiplatelet medication used to reduce the risk of heart disease and stroke induced at high risk. It is also used together with aspirin in heart attacks and following the placement of a coronary artery stent.
Health Matters is the informational webcast brought to you by NetMeds, designed to keep you informed and up to date on popular medicines, emerging therapies, and even cutting edge strategies for enhanced wellness, less sickness, and greater energy. This medicine belongs to a group of medicines called antiplatelets. It is used to prevent blood clots forming in hardened blood vessels, arteries, which can lead to stroke, heart attack, or death. Talk to your doctor before taking this medicine. If you're allergic to clopidogrel or any other ingredients of this medicine, or if you have any internal bleeding such as stomach ulcer or bleeding within the brain, or if you are suffering from severe liver or kidney disease, or if you have any blood disorder, or if you had a recent serious injury, or if you're planning for a surgery including dental in the next 7 days, or if you have had a clot in an artery of your brain which occurred within the last 7 days. If you're pregnant, planning to become pregnant, or are breastfeeding, you should consult with your doctor before taking the medicine. Tell your doctor if you're taking medicines such as medicines used for the treatment of depression, pain and inflammation, epilepsy, cancer, diabetes, stomach acid, fungal and HIV infection, and other anticoagulants. Refer to the table for detailed information on drug interactions. Inform your doctor if you notice any of the symptoms such as fever, signs of infection or extreme tiredness, or signs of liver problems such as yellowing of the skin or the eyes, or swelling in the mouth, or skin disorders such as rashes, itching, and blisters on the skin. For further details, refer Consumer Medicine Information at netmeds.com.
Applications in medicine. It is used to prevent heart attack and stroke in people who are at high risk of these events, including those with a history of myocardial infarction and other forms of acute coronary syndrome, a stroke, and those with peripheral artery disease.
Blood clots form the pathophysiological basis of a few common and often serious diseases in medicine. These include myocardial infarction, ischemic stroke, critical limb ischemia, deep vein thrombosis, and pulmonary embolism, to name a few. A blood clot can be accurately referred to as either a thrombus or a thromboembolism. A thrombus is a blood clot that has formed and remains fixed at the site in the blood vessel, whereas a thromboembolism detaches from the original site of formation and migrates, leading to an occlusion elsewhere in the circulation. Deep vein thrombosis is an example of a thrombus which can potentially embolize and lodge elsewhere in the circulation, such as the lungs, where it becomes a pulmonary embolus. We typically use two groups of drugs to prevent and treat thromboembolic diseases, and these groups are antiplatelet drugs and anticoagulant drugs. Antiplatelets include drugs such as aspirin and clopidogrel, whereas anticoagulants include three main subgroups, which are warfarin, heparins, and non-vitamin K oral antagonists such as apixaban, rivaroxaban, and dabigatran. Now, the hemodynamics of arteries and veins differ mainly in terms of the pressure inside them and the shearing forces, and this accounts for why the kinds of thromboemboli that form in arteries and veins differ. Typically, thrombi which form in arteries are made up largely of platelets and are referred to histologically as white thrombi. In arteries, these thrombi typically form on the surface of atherosclerotic plaques, and this is referred to as atherothrombotic disease. Atherosclerotic plaques don't really occur in veins because of the low pressure, and so the major factor in venous thrombosis is simply stagnation of blood, or venous stasis. And we know this because it makes up part of Virchow's triad of thrombosis. In veins then, the thrombus is not made largely of platelets, but instead usually consists of a fibrin mesh compacted with red blood cells, and so it is histologically described as a red thrombus. Because these two types of thrombi are composed of largely different materials, the drugs we use to treat them differ. MI, ischemic stroke, and peripheral arterial disease are examples of atherothrombotic disease, and so the clots that cause these diseases are made up mainly of platelets, and so antiplatelets have found to be the most effective treatment in preventing these diseases. In DVT and PE, however, anticoagulants are found to be more effective, because anticoagulants inhibit aspects of the clotting cascade, and the clotting cascade results in the production of fibrin, which is the main component of these clots. It is important to note that stroke prevention is one anomaly to this rule, in that we prevent stroke using both antiplatelets and anticoagulants, depending on the cause. This is because strokes can be caused by atherothrombosis in the cerebral arteries, or be caused by emboli that form elsewhere in the body and end up in the cerebral arteries, leading to occlusion, ischemia, and stroke. The most common cause of embolic stroke is atrial fibrillation, where blood in the atria becomes stagnant, leading to thrombus formation. If this thrombus destabilizes and embolizes, it can be forced by the heart up into the cerebral arteries, leading to stroke. So in patients with atrial fibrillation, we use anticoagulants because the main reason for clotting in these patients is again due to the stasis of blood, rather than atherothrombotic disease. So how does clopidogrel act as an antiplatelet? Clopidogrel belongs to a group of drugs called thienopyridines and ADP receptor antagonists. Other examples of these include ticagrelor and prasugrel. When the lining of a blood vessel is damaged, this exposes collagen and von Willebrand factor, which causes circulating platelets to rush to the site of damage and bind. This binding causes activation of the platelet, which involves a change in shape and a release of granules containing chemicals, one of which is ADP, or adenosine diphosphate. ADP binds to ADP receptors on other platelets and causes activation of these platelets, helping to facilitate aggregation of platelets and clot formation. Let's look closer at how this works. So ADP binds to these ADP receptors, which does two things. The first of these is the release of the dense bodies containing thromboxane A2 and ADP and other chemicals, which causes activation of other platelets. The second thing it does is the activation and expression of glycoprotein receptors in the cell membrane of the platelet. These glycoprotein receptors enable platelets to bind to one another using fibrinogen as a crosslink. This forms the basis of platelet aggregation and clot formation. Clopidogrel is a prodrug, so first it gets converted into its active form in the liver. The active metabolite then blocks the ADP receptor, preventing the binding of ADP. Ultimately, this leads to reduced platelet aggregation and clot formation.
Pros and cons. Pros. It is used for prevention of thrombosis after placement of a coronary stent. Treatment with clopidogrel is recommended for treatment with a myocardial infarction with ST elevation and for treatment of a non-ST elevation myocardial infarction or unstable angina. Cons. Serious adverse drug reactions associated with clopidogrel therapy include thrombocytopenic purpura and hemorrhage, rashes, and itching. Issue applied in Ecuador. Clopidogrel is used in Ecuador for patients with heart diseases, and it is administered orally once per day with or without food.
The antithrombotic treatment in TEVI patients who are not on oral anticoagulation is similar to those treated with a PCI, which is dual antiplatelet therapy early after TEVI. However, TEVI patients are considered to be more at risk for bleeding due to the advanced age, more comorbidities, and the use of large bore catheters. Therefore, in the cohort A of the popular TEVI trial, we hypothesized that the omission of clopidogrel after TEVI reduced bleeding while not increase thromboembolic events. And therefore, we randomized in total 690 patients to either aspirin alone or aspirin plus 3 months of clopidogrel. 331 were randomized to aspirin alone, and 334 were randomized to aspirin plus clopidogrel. And the results of the primary outcome, all bleeding, were significantly reduced with an aspirin alone strategy, with an absolute reduction of almost 11%. The results of the co-primary outcome, non-procedural bleeding, were also significantly reduced with an aspirin alone strategy, with an absolute reduction of almost 10%. And for the secondary outcomes, we used 2 composite outcomes. The first composite outcome was the composite of cardiovascular mortality, non-procedural bleeding, stroke, or myocardial infarction, which was superior for aspirin alone and significantly reduced with an reduction of 8.2%. And the second composite was the composite of cardiovascular mortality, ischemic stroke, or myocardial infarction, which was non-inferior. Aspirin alone was non-inferior compared to aspirin plus clopidogrel for 3 months, with an absolute difference of 1.2%. And the conclusion is that of the popular TEVI trial cohort A is that an aspirin alone strategy without clopidogrel significantly reduced the rate of bleeding events and does not increase the rate of thromboembolic events.
Conclusion. Clopidogrel is an antiplatelet medicine used to prevent blood clots in patients who have heart attacks, stroke, or circulation problems in arms and legs. It works by preventing platelets in the blood from sticking together to form clots that can occur due to certain conditions. Thank you.